According to health charity organization Sightsavers, about 1 million adults are blind in Nigeria. Another 3 million Nigerians are visually impaired, while 42 out of every 1,000 adults aged 40 and above are blind. Welcome to another edition of Health Matters, your TV health program on OSRC television. I am Damilola Agunroye, and today on the program we'll be talking about eye diseases. We'll be looking at the causes, the symptoms, and also the prevention, how to prevent it. And with me in the studio, I have Dr. Olufunmi Samo. She's Chief Optometrist, Ondo State Hospital's Management Board, Akure. Dr. Olufunmi, it's good to have you in the studio.
Thank you very much for having me.
Now, we want to talk about eye diseases.
On a broader note,
Okay.
I would just say an eye disease is any condition that is away from the normal.
Okay.
Anything that does not allow you to have optimal eye health, like you're not seeing well, or you're having itching, or you're having eye ache, or the eyes are red. Anything that is away from the normal eye, that's an eye disease.
So what are now can you explain the causes of these eye diseases?
Now we have different types of eye disease, very broad.
Okay.
And in life, like I always say, every one of us will have a need to visit the eye clinic at one time or the other, whether at a young age or as an adult or an old person. You know, so the causes of eye disease are various. First, it could be congenital. That means somebody can be born with an eye problem.
Okay.
That's why we always advise pregnant women, don't take some drugs. Be careful of what you use when you're pregnant. It could be when the person has been born and is moving around, maybe teenagers. You have some peculiar conditions that are peculiar to teenagers. And then you have the ones that are peculiar to when you are old, maybe like 40 years and above. Some people say they cannot read again, and they were seeing before. Some will tell you that it's because I cried too much.
Okay.
That's why I'm having that. It's because of age. There are some that come with age. So those are the different types. It could be congenital, it could be refractive, and it could be a serious disease condition. It could be an injury or a lifestyle problem that came on from the kind of lifestyle. For example, for some people that smoke,
Okay.
the smoking will not bring an eye problem immediately. It is towards the latter end of their years that something starts happening to them because of the kind of lifestyle that they have lived. They didn't come with that kind of eye, but because of the smoking, it has impaired on their eyesight. So those are the different types you can have.
So let's talk about the symptoms related to these eye diseases. Like the symptoms, like if you notice something is happening to your eye.
Yeah.
So let's talk about that.
Thank you. Now, different types of symptoms. The commonest one is red eye. Once you see somebody, most eye conditions, some of them come with red eye. And so, once you have a red eye, it's best for you to visit your eye doctor.
Is the red eye the same thing with Apollo? Is it what we call Apollo or conjunctivitis?
Everybody most people call any red eye, they'll call it Apollo, but not all red eyes are Apollo.
Okay.
There are some conditions. For example now,
Okay.
if something, maybe a particle enters into your eye, definitely, because of the way you rub and it will get red, that one is not Apollo. But most people will say red eye is Apollo. So that's why we say any time you have any red eye, those are some of the symptoms you can see that warrant you to see your doctor, because your doctor will now be able to decipher and know which one is which. If you have any red eye, if you have any tearing, maybe your eye is just bringing out water. Just bringing out water. You are not crying and the water keeps coming. When there's any discharge, whether it is light discharge or plenty discharge, whether your eye gum together when you wake up in the morning and you can't open it, whether the eyes are aching, whether they are itching seriously, like some people will say whether you feel as if there's sand in your eye and it's feeling very gritty. All these are different conditions, or you are not even seeing well. Some people will tell you, I can see your figure that you are the one. I know it's a human being, but I can't see the face.
When you are not albino.
Well, Albi. So those are the things. Some people will look and they say, I see the figure, but I can't see the face. Those things you need to visit the eye doctor. You need to visit your optometrist so that they know which is which, and you can then be directed to the appropriate quarters.
So now let's talk about the common eye diseases, like here in Nigeria. What are the common eye? Is it just mention the names of the diseases and let's.
Like in Nigeria, the most common, like we have said, just like the one that is happening right now, a lot of people are down with one red eye or the other. They'll say they have Apollo. It's all over the place now. Apollo is there. In Nigeria, we have it a lot. Apollo is there. Conjunctivitis. We have cataracts.
Okay.
Some people have cataracts, and that is the clouding of the lens in the eye. The lens that is inside the eye is supposed to be transparent so that light rays can pass through and then send signal to the brain, and the brain can then interpret. But when there's a clouding, that means it becomes whitish. It's not clear. It becomes kind of opaque. Okay. Then we call it lens opacity or cataract, depending. That's cataract. It's quite common too, especially in the elderly. Although now we are seeing it more we are now seeing it in young people, even children. Now, because of some reasons, one reason or the other, but usually you find it in the elderly. So you have cataract. We have glaucoma. Glaucoma is a group of diseases whereby you see some people with high intraocular pressure, just like you have your blood pressure. When the intraocular pressure too is very high, it will cause damages to the nerves in the eye. And the most fearful thing about glaucoma is that once it chokes the nerves and they die, the vision that is lost cannot be regained.
Oh, that's in glaucoma.
In glaucoma, unlike in cataract, whereby once the opaque lens, the ones that is opaque is removed, the person starts to see again. But in glaucoma, once the nerves are choked and they die, the vision cannot be regained. And that's why there's a cliche they give to it that glaucoma is a silent thief of sight.
Wow.
It's a silent thief of sight. And more often than not, it doesn't give symptoms.
Oh.
It doesn't give symptoms. The eye will not be red. It will not pain the person. In most of the cases.
Then how do you know that you have the disease?
That is why we are coming to.
Okay.
The importance of prioritizing your eye health. You cannot overemphasize that at all. In this part of the world, people don't go to the hospital except there's a problem.
Exactly.
So that is why we have to change that narrative and make sure we go for yearly checkup, at least once in a year. If there's anything wrong in your eye, once you go for a checkup, go to your optometrist. They will check you. They will tell you what the problem is. A lot of people shy away from that. They say, if we go now, they told us to come and take glasses. No. It's not everything. Like I always tell people, everything is not about glasses. There are some conditions, once you notice that this is the problem, you know what to do, especially in the case of glaucoma now. Once they notice that the intraocular pressure is high, then they find a way of giving you drugs to bring it down, or even if it will need surgery. In some cases, some people will still need surgery. So different treatment regimen, depending on what the condition is at that time. So aside from that, we've talked about cataract, glaucoma. We have refractive errors. That one is very common. And it cuts across in children, in adults. That one has to do with the way you see. Yes.
Short-sighted.
Whether you are short-sighted, that's why people cannot see. Some will say, I cannot see far, but I can read anything.
Okay.
Some will tell you, I cannot read at all, but I'm seeing you very well.
Attractive.
So we have different types of refractive error. It could be myopia, hyperopia, astigmatism, presbyopia, different types. But those ones, they can be corrected or they can be aided with the use of glasses or contact lenses, depending on which one will be suitable for that person. So, cataract, glaucoma, refractive errors, and then you have some age-related issues, like you have age-related macular degeneration, and then you have some issues that have to do with your general health. For example, people that are diabetic, people that are hypertensive, it has a way of affecting your eye.
So it's interwoven somehow.
Yes, and that's why when somebody is diabetic, we always say, first of all, you treat that first before coming to the eye. If you are taking care of eye and you are not taking care of that diabetes, it's not going to help. And with time, the person might have impaired vision because of what we call diabetic retinopathy, or you can have hypertensive retinopathy. Those ones come as a result of the illness in the body, like hypertension, like diabetes. So those are the broad ones that we can have.
Thank you very much, Dr. Samo. Let's quickly go on a break, then we'll be back shortly. Well, you're welcome back. If you are just joining us, it's still Health Matters, your TB health program on OSRC television. This week we are discussing eye diseases, the different types of diseases. Before we went on a break, our doctor, that is Dr. Samo, has been able to explain to us the types of eye diseases that we have. She explained to us what glaucoma is, which happens to be one of them, and cataract also. So now that we are back, we now continue with the types of yes, before the break we discussed about the types of eye diseases that we have. Now let's talk about glasses usage. How important is it? How do you recommend glasses to people nowadays? Let me go to our youth now. When you see a youth out there, maybe let's say due to peer pressure, you see him or her using glasses. Some will mistake recommended glasses to recommended glasses.
Yeah.
So how do you recommend a glasses to a patient? Do you know?
Now, before somebody is given glasses, that's why I would say visit your eye doctor. Specifically, see your optometrist. They will run a test on you, and they will know whether you actually need that glasses and the type that you need. Like, for example, some people will say, it's a lie, just tell them that you cannot see and they will give you something. That's for people. That's why it's important to go to
An optician,
an optometrist that knows what they're doing.
Doctor.
Yeah.
What's the difference between, to a layman out
Yeah.
there, an optician and optometrist?
An optometrist is an eye doctor
Okay.
that's trained to examine your eye, diagnose, and treat your eye with whichever thing you may need, whether drugs or glasses, and make adequate referral if necessary. An optician is a technician.
Oh, okay.
Is a technician. After the test has been done and everything, the technician can fix it.
Oh, okay.
It's not to diagnose, it's not to examine you.
Oh.
So that is the major difference.
Yeah.
So
Thank
we
you
see
for
a
that.
lot of things happening now. You see people going up and down and they say, we are eye doctor, we are this. They are not. Their job is to fill up your prescription that the optometrist gives to them.
Oh, okay.
So that is the
Thank you
major
for that.
Yeah.
Thank you for that.
Then,
So,
if I may add, the optometrist goes to the university, 6 years, you do your housemanship, you do your service.
oh,
The optician, I think, is an OND program.
thank you
So,
very much for that.
Those are
For
the
that.
difference.
So, I think we're talking
Yes,
about
we're
glasses.
talking about
Yeah.
glasses. Yes. So the optometrist will examine your eye and know the type of glasses you need.
Okay.
And if you don't need glasses, they will know.
Okay.
There are tests we run that will make us know whether somebody needs glasses or not, because you have these kind of things in children that their friend is wearing glasses. They also want to wear, so they will come. So we know those type, so we can then advise the parents appropriately.
Okay.
To know whether there are some glasses you can give to such children that will not have any power. It will not harm their eye at all, but they will save the parents wahala. And at the end of the day, after using for 2-3 months, they will tell you, it has corrected my eye. I'm now fine, because they are tired of wearing the glasses. Exactly. Although we have glasses that are corrective too. So the optometrist will tell you which one you need and how to go about it. And if it is not glasses, they can say, okay, we are going to use contact lenses. That's another aspect.
Yes, there is a question that is bothering me that I would like to ask too. This content, like in cosmetics of nowadays, ladies implants, is it contact lens?
It's contact lenses.
How dangerous is it? Because when you see a lady with a blue eye, green eye,
those ones are cosmetic contact lenses.
Okay.
Ideally, before you go for cosmetic contact lenses, you needed to have seen your optometrist first.
Okay.
There are tests that will be done to know whether you can even use it.
Okay. It's not meant for everybody.
It's not meant for everybody. Some people cannot use. For example, people that have excessive dry eye, and you are going to be putting contact lenses, just buy off the shelf and put in your eye, you're looking for trouble. It might not be immediate, but on the long run, so it may damage your eye. But contact lenses on its own is not it's not as if it's dangerous.
Okay.
Because we prescribe it. There are some people that it is contact lenses you prescribe for them. When you use it the way your optometrist tell you to use it, and you take adequate precautions, you're fine. There are some people that can't, they will tell you they don't like glasses, but they prefer to wear it, and they're
so
fine.
medically it's allowed.
It is allowed.
Okay.
And cosmetologically, for people that want to do, like all these artists and all these filmmakers, they want to have blue eyes when they're doing some things, it's also allowed. But see your optometrist first before you use it, and then when you are using it for such programs, once you are through with your program, you remove it.
Okay. You remove
it.
Okay.
Even most contact lenses.
Like for how many hours can you put it on?
No, you can use it the whole day. Contact lenses you can wear from morning till evening, but don't sleep with it.
Okay.
Before you go to sleep, you remove and you keep it.
Okay.
In the morning, you rinse it and you put it back.
Okay.
Even for people that have prescriptions, that's what they do.
Yes.
So we're talking about glasses.
Yes, we're talking about glasses.
So we know the type of glasses. So all these glasses that people are buying off the shelf is because, I don't know, like in Nigeria now, we have issues with a lot of standards. Some glasses are not what you can just go off the shelf and you just buy and you are just putting it on your face. You have not done your test. You don't know what is wrong with your eye. You don't know if it can damage your eye the more. You don't know the type of lenses you need. Whether you need a plain white lens, or you need a lens that is photochromic, or you need a lens that helps you with digital strain for your computer, or you need a lens that blocks ultraviolet rays, depending on the kind of job you're doing. So you must know the type of lens. That's where the position of the optometrist comes in.
Okay.
Once they see you, they will know the kind of job and they will be able to tell you which one is best for you. But I will say, buying glasses, just buy one and just be wearing is not so good for your eye.
It's wrong. Now, well, before we go, Dr. Samo, while reading the statistics earlier, we talked about 1 million adults that they are blind in Nigeria. Can you tell what are the causes of blindness in Nigeria?
Apart from the disease condition itself, it could be cataract, it could be glaucoma, it could be anything. The major one is knowing where to go and having access to good eye care. Okay. A lot of people use different things in their eye, thereby complicating. Maybe the condition itself is not supposed to blind, but because of the things they put inside. For example, self-medication, wrong medications. You can imagine, for example, maybe someone has an eye problem, instead of you to go, you say, I don't have money. Economy too is part of it. You say, I don't have money. You now go to the back of the house, you cut leaf, and you are putting the sap into the eye. Thereby, more microbes will be growing in that eye and cause further damage.
Okay.
So those are the things. So many self-medication, wrong medications. Some people will say, children, when they have problem, mama, put breast milk into the eye. That's not it.
Okay.
Wrong lifestyle, smoking,
Okay.
drinking, all those things will have effect on your eye later. Yes. So lifestyle too. Digital display units that we are using. Everybody is now using a phone, using a laptop. The rays from the laptop, from the phone, they all have effect on our eye if you are not using the right protective measure. So I will say, as much as possible, people should visit the optometrist, know what to use, and use it the way they tell you to use it. For example, some people will give them drugs, take this medicine, put in your eye. After using it, once there's a problem in that eye, maybe 2 years after, they will go and look for that drug and go and buy it. They say, it's my doctor that gave me one time ago, and I went to buy it. Are you sure it's the same condition that you have now?
Okay.
So those are the things. So a lot of self-medication, a lot of wrong medication, and maybe economy.
Thank you very much, Dr. Samo. Our
Thank
time
you.
is fast spent. Now, finally, we need your advice. Like, what can we do to keep our eyes as healthy as possible?
Some few tips. One, good nutrition.
Okay.
Eat balanced diet. Eat fruits and vegetables. Stay away from a lot of these denatured foods as much as possible. They are not helping the body, and anything that is not helping the body will not help your eye. Then 2, go for regular checkup.
Okay.
Once or twice in a year. Make it around your birthday so that you don't forget, because you will not forget your birthday.
Yeah.
So make sure you check your eye so that if there's anything, it can be noticed on time and taken care of. And then number 3, make sure you don't instill anything into your eye that was not prescribed by your optometrist or your ophthalmologist or your eye care practitioner. That's it.
Thank you very much, Dr. Samo. Thank you very much for coming on the program.
Thank you.
Well, viewer, this is how far we'll be going today on this week edition of Health Matters, your television health program on OSRC Television. This week we have talked about eye diseases, the types of eye diseases, and we've been able to talk about the symptoms, the causes, and how it can be prevented. Well, and I'm sure you must have learned a lot from our doctor and optometrist, Dr. Olufunmi Samo, today on the program. Until next week, when we'll be coming your way again on another interesting health topic, I remain yours sincerely, Damilola Agunloye, saying take good care of your health. Health is wealth. Bye for now.